Good morning. My name is Paul Edwards. We're glad that you can join us for today's briefing on the COVID-19 crisis here in Utah. Today we'll hear from Governor Gary Herbert, and he'll be followed by Dustin Jansen, the Division Director of the Utah Division of Indian Affairs, and Spencer Cox, Lieutenant Governor. They'll be followed by Dr. Angela Dunn, our state epidemiologist, and Gary Harder, the Executive Director of the Department of Veterans and Military Affairs for the state of Utah. Governor Herbert.
Well, thank you, Paul. And good morning, everyone. We're honored to be with you again, and thank you for your attendance. And for those who are participating, we welcome you. I think there's a lot of reason to be hopeful and optimistic at the future of Utah. As we look at the data, we see that, in fact, those applying for unemployment is dropping for about 7 weeks in a row now. So that's a good sign that more and more people are going back to work, at least not being put out of work. Our unemployment rate, as you know from last Friday's announcement, is at 9.7%. which takes us back to kind of the era of the Great Recession. But other parts of the country are, in fact, 5 points higher than that. So they're about 14.7, 14.9 right in there. So significantly higher, nearly 50% higher than what we have here in the state of Utah. Some states are very much hospitality driven, tourism and travel trade, like Hawaii, like 28%. I mean, now you're talking about Great Depression levels. So again, as we've opened up the economy, we see hopeful signs of people getting back to work, stabilization taking place. And I'm very hopeful if we continue to follow the protocols we've outlined, that we'll continue to, in fact, improve. It's up to all of us. We have a role to play, all of us, to do the right thing to make sure that that happens. I do want to mention, though, one area that's of significant concern for me and others. An area that's really been ravaged by the coronavirus is the Navajo Nation. Again, for you that don't know, the Navajo Nation is down in the Four Corners area of Utah. They border on Colorado. They're not in Colorado, but they have a little bit in Utah and a lot in New Mexico and Arizona, where their headquarters are in Window Rock, Arizona. So the concern we have, just to give you an idea of how bad it is, a recent press release they had out here this past Tuesday showed the Navajo Nation had a population under 200,000 people, mind you, had a deaths total now of 158. To give that comparison, you know, in Utah, where we have 3.2 million people, we're just over a little over 100. So they have the highest rate of infection and death rate now in the nation, in the United States. Our hearts go out to all of our Navajo friends, brothers and sisters down there for the challenge, and I've had an opportunity to work closely with President Nez of the Navajo Nation and Vice President Leiser, and we've done a lot from the state of Utah in trying to help bolster what's happening down there and providing assistance. The state of Utah really has not taken a back seat on this, even though we have a smaller part of the Navajo Nation and our borders. We're doing a lot more, and I think significant more yet to come. I think it also bears mentioning, because people wonder, you know, the San Juan County has been put at yellow. The sliver portion of the Navajo Nation, that's the bottom of our state, is in fact a sovereign nation. So any health advisories, any protocols that they want in place on the reservation, on the Navajo Nation, is put in place by the Navajo leadership themselves, not by me, not by anybody else. They're a sovereign nation, sovereign lands, and so they make their own policy, including health directives. We would strongly encourage any Utahns that live close to the border or on the reservation to follow all the tribal health directives. They're trying to get a handle on this. We're trying to give them some assistance. But again, if you're on Navajo Nation lands on the reservation, you need to follow their directives and not be following Utah's directives, which could be different. Because these issues are so serious, and because a partnership that we're forming to provide relief, I wanted to have an opportunity for the people of Utah to know what we're doing to help our Native American brothers and sisters on the Navajo Nation. And so we're going to hear from our Division of Indian Affairs, Dustin Jansen, about some of the outreach efforts that we're putting together for the Navajo Nation. And along with him, we'll have Lieutenant Governor Spencer Cox, who's worked with our Farm Bureau. In fact, we delivered 1,000 sheep, I think, last week, and more to come this weekend. And he can speak about that. And then they'll take a few questions, maybe a couple. We don't have a lot of time. And then an update from Dr. Angela Dunn will follow that.
Hello, my name is Dustin Jansen. I serve as the Director for the Division of Indian Affairs for the state of Utah. I would like to acknowledge the elected officials of the tribal governments of the state of Utah, the Confederated Tribes of the Goshute Reservation, the Paiute Indian Tribes of Utah, the San Juan Southern Paiute, the Northwestern Band of Shoshone Nation, the Skull Valley Band of Goshutes, the Ute Indian Tribe of the Uinta and Ouray Reservation, the Ute Mountain Ute Tribe, White Mesa Community, and the Navajo Nation. Their leadership has been putting forward a great fight and a lot of work just to look after the well-being of their people. I would also like to thank Governor Herbert for his efforts, Deputy Chief of Staff Mike Maurer, and Larry Echohawk, Special Counsel for Indian Affairs. Melissa Zito and Jeremy Taylor of the Utah Department of Health in the Indian Health Office, and Anna Boynton with the Division of Emergency Management. Their concern and hard work has been essential to the health and safety of Utah's Native communities. This pandemic has hit all of the tribal lands hard and very seriously, but the Navajo Nation has especially been suffering at high numbers. I'd like to recognize the effort of President Nez, the Navajo Nation Council, and the elected chapter officials that are working every day, boots on the ground, to serve and look after their people. The Department of Health and Division of Emergency Management have maintained a situational awareness, communication, and collaboration with all tribes and partners, all the while respecting the government-to-government relationship between the state and tribes. Through the Department of Health and Division of Emergency Management, the state remains in constant communication with tribal, state, county, and FEMA partners to support tribal emergency management. Regular meetings are held weekly, sometimes daily, with tribal representatives to ensure that the needs of Utah's Native communities are met. Utah has supported COVID-19 testing capacity through the deployment of mobile testing units. Twice, they have gone out to the Confederated Tribes of the Goshute Reservation. They have gone once out to the Ute Mountain Ute White Mesa community, and on 4 occasions they have gone out to the Utah portion of the Navajo Nation in the Navajo Mountain, Monument Valley, and Montezuma Creek communities. As of May 26, there are 251 positive cases in the Utah portion of the Navajo Reservation and 4 reported deaths. Utah has provided personal protection equipment to the Navajo Nation and pushed out public health emergency preparedness annual grant funding to the Utah Navajo Health System, EMS, and preparedness programs. The Utah National Guard has completed assessment of alternative care sites, quarantine and isolation sites, in collaboration with the Utah Health System. The Utah Department of Health and Division of Emergency Management are in constant coordination with non-governmental, nonprofit organizations, and volunteers who are delivering food and PPE to the Navajo Nation chapters. Utah is partnering with the Utah Farm Bureau and Farmers Feeding Utah in the delivery of 16,000 pounds of lamb, 300 head of sheep, and 10,000 pounds of flour, as well as a bi-weekly delivery of fresh vegetables to the Navajo Nation chapter areas in Utah. That's the end of my report, and I'll turn the time over to Lieutenant Governor.
Thank you, Dustin, and Governor Herbert for your leadership. Good morning, ladies and gentlemen. I'm proud to be here with you today to discuss a few things that have transpired and brought my heart through the difficult days of our COVID-19 response in Utah, and that is the generosity of all Utahns, and to thank you for your generosity in helping support each other through this COVID-19 crisis. We have been strong, and we will remain strong. And I know of no better way to do that than to strengthen one another. When we first began our response to the COVID-19 pandemic, someone I look up to very much reminded me that all along there will be silver linings. There will be heroes who care, who innovate, and who solve problems. I want to share with you a couple of those silver linings that have brought us courage and heart through this difficult time. At the beginning of this month, I was fortunate to help launch the Farmers Feeding Utah program, a homegrown, rural, and innovative solution to sustain farmers and help families at the same time. In both the good times and the hard times, Utah farmers have been passionate about feeding people. Utah farmers and families have been particularly impacted by this pandemic. Many important supply chains have closed down, leaving farmers unable to sell their Utah-grown products. All of this has been happening as a record number of Utahns have been furloughed or seen their pay cut due to impacts of the coronavirus. Therefore, more families than ever are in need of food resources. Farmers Feeding Utah was launched as a partnership between the Utah Farm Bureau and Utah State University's Hunger Solutions Institute, and with contributions from our own Department of Agriculture and Food. The project connects Utah farmers with those in need of safe and locally grown food. 100% of donations received are going to purchasing, processing, and distributing locally sourced food to Utah families. So here's how it works. First of all, you donate, we donate. Second, we use the donations to give a struggling farm or ranch family a hand up by purchasing their product. Third, we get the product processed so it can be delivered to the needy. And finally, we partner with charitable institutions to get 100% of the benefit to Utahns in need. This really is the Utah way of creating multiple wins for everyone involved. And I'm so happy to be able to showcase what has been done. In only a few weeks since this program was launched, Farmers Feeding Utah has worked with Governor Herbert's leadership team and the Division of Emergency Management to create an amazing partnership with our friends and leaders in the Navajo Nation. As Governor Herbert and Dustin Jansen mentioned, we've been working hard with our Navajo counterparts to provide testing, medical supplies, and personnel during this crisis. Dustin also outlined what is happening with Farmers Feeding Utah. Farmers Feeding Utah sent more than 300 live sheep, with another 300 live sheep planned for next Monday, and 16,000 pounds of frozen lamb to southern Utah. They also donated more than 10,000 pounds of flour to members of the Utah chapters of the Navajo Nation. The Utah Farm Bureau rounded up ewes from ranchers in Sanpete County and delivered them to Montezuma Creek in San Juan County. Volunteers there delivered the sheep and flour to needy families. Now, my friend Rebecca Benali said that Navajo people consider a live sheep one of the greatest gifts someone can give. She was a driving force in helping get this food to the people that need it most, and I want to personally thank Rebecca for her help. And this is just the start. There's much more to come from Farmers Feeding Utah, and we are pleased to announce their next miracle project, which will take place in northern Utah, benefiting the communities in Box Elder, Cache, and Rich counties. These food pantries, the food pantries in these areas have seen increases of 20 to 30% in use of their services over the past couple months, and they need help to continue feeding Utah families. Their areas have a large number of farms in our state. The organization has set a campaign goal to raise $150,000, which will be used to help supply the shelves of local food pantries and needy families. This is a lofty goal, but I have no doubt that it is one that we can reach. I am calling on everyone in Utah who is able to contribute, including specifically our business community. Please visit farmersfeedingutah.org. That's farmersfeedingutah.org, where you can find a variety of ways to donate. And to our Navajo friends, President Nez and others, our hearts are truly with you as you have experienced these immense difficulties. Now, I also want to address something wonderful that is happening in the world of our nonprofit organizations here in Utah, also due to the incredible generosity of Utahns. Nonprofits face a significant financial risk because of dramatic reduction in major philanthropy, grants, and individual donors. Social service nonprofits are seeing rapidly increasing needs at a time when they have fewer employees and reduced supplies and too many shuttered offices. A new study from the Americans for the Arts underscores the threat to arts and cultural nonprofits. It shows that nonprofit arts groups have lost nearly $5 billion nationally, and more than 200 million admissions have been lost because of canceled events. In Utah, we know that similar impacts exist because of cancellations to major events like the Utah Shakespeare Festival, the Utah Arts Festival, and multiple concert series, as well as smaller community events. The nonprofit fund, something we talked about a while ago, launched when we first began responding to the pandemic. The purpose of this nonprofit fund will help nonprofits survive until they can once again open their doors and welcome back patrons into their theaters, museums, and galleries. To date, more than $170,000 has been donated to the fund. That includes very generous donations from the following people and organizations. Rudy Gobert, who donated $50,000 within days of the fund being launched and has donated to other efforts as well. The Utah STEM Foundation, the nonprofit arm of the Utah STEM Action Center, donated $50,000. This donation recognizes the importance of the integration between STEM and the arts, or STEAM, as the First Lady and the Governor often put it, and the need to support the need for support of cultural nonprofits. The Workers' Compensation Fund also donated $15,000. The Church of Jesus Christ of Latter-day Saints donated $10,000. The Sam and Diane Stewart Family Foundation donated $5,000, and many other individual donors. The fund will also include more than $400,000 in nationwide endowment for the arts funding through the CARES Act. The first round of funds will be distributed in June and will be a boon to this important part of the fabric of our community through this difficult time. So many of us have stepped up to do so much. One of the first calls I received when all of this started was from Ty Burrell, who was leading the way to help hospitality workers who had lost their employment. Working together, we are all making the best of a difficult but improving situation. This is what makes Utah so special. We've said it many times and we'll say it again. We lead the nation in charitable giving and we lead the nation in volunteerism. And never have we needed that charitable giving and volunteerism more than we need it right now. As children are done with school and homeschooling, and families have more time together over the summer months, I would encourage you, as your life is changing and the tempos are changing, as we're getting back to some semblance of normalcy, to visit coronavirus.utah.gov/help. It's coronavirus.utah.gov/help, and consider what you and your family can do to contribute and donate and volunteer during these summer months to help so many that are in need. We will, in all likelihood, look back on this time as stressful and unsure, and of all those feelings that come with a global pandemic. But because Utah is truly exceptional, we can also take advantage of the many opportunities that we have to serve. And we will look back on this time as a time when our hearts changed for the better, as a time when we reached out to our fellow Utahns who are suffering, as a time when we came together, got rid of the politics of the situation, and bonded together to help those in need. So again, I would direct you to coronavirus.utah.gov/help. You can see many of the projects that are going on there, including the Utah Tribal COVID-19 Relief, help with Project Protect, making masks, which is still ongoing, helping with personal protective equipment, supporting Utah rural and minority small businesses, providing support for vulnerable populations, donating to frontline workers and food and beverage workers, giving blood. The Larry H. Miller Group announced a big blood drive that is coming up next week. We would encourage you to sign up to give blood, as there is definitely have huge need there, and then volunteering with You Serve Utah and so much more. With that, Dustin and I have an opportunity to answer maybe two questions if there are any, and Governor Herbert will be available to answer other questions as we finish up the event today. So any questions for myself or for Dustin?
Thank you. And this is Chris Reed with St. George. So my question is for Mr. Jansen. Why specifically has this hit the Native American community so hard? And not to lump this in together, but people of color in the state, between the high percentage of Latinos and Pacific Islanders, have also been proportionately affected by this virus. But why specifically has the Native American community been struck so hard?
You know, there's probably 100 reasons for that, but one of the main reasons is that the tribal nations were hit last. For example, the Navajo Nation, if it was a state, it probably would have been the 48th state that was hit really hard with COVID-19. And so by the time their need came up, you know, as far as supplies go, as far as PPE goes and medical and testing kits go, they were a little behind in that. So that's one of the major reasons for it. Another reason is they're a rural area. Rural areas are a lot more social sometimes, and just getting the word out to everyone to be able to self quarantine and the importance of that can be difficult. The infrastructure on a lot of reservations isn't where it's at, and most of the state, the access to internet, access to good roads, access to clean water, all those things play an important part in that question.
And I have a quick follow-up. I know that also the Utah Department of Health has sent out teams out there. What progress is being made now, and what chances are there to stabilize things in the Navajo Nation?
Well, the Navajo Nation, if you follow their Instagram page, the president, Nez Leiser, you'll see that they release reports daily to show what the numbers are, what new cases are, how many recoveries there are, how many more fatalities there are. But you're going to see that their numbers are going down in many respects. But that question might be better answered by Anna Boynton in Emergency Management and also Melissa Zito with Utah Department of Health in the Indian Health Office.
The only other thing I would add to that is with our mobile testing that we have deployed now 3 times there, if you look at the testing rates per capita in the state of Utah, San Juan County now leads the state in the number of tests that have been performed per capita, specifically because of what has happened with our mobile testing being deployed to the Navajo Nation to get as many people tested as possible, and then that will allow the nation and health professionals to respond and make sure that we can stop the spread of that virus. So with that, I think that's all the time we have for those questions, and we'll go ahead and move on to the next portion. Thank you.
Hey, good afternoon. Give you an update on our situation. We currently have 8,921 cases of COVID-19 identified in Utah. That is an increase of 215. Over the past week, however, we have seen an increase of 1,047 for an average daily growth rate of only 1.8%. As of today, we've tested over 200,000 Utahns for COVID-19, an increase of 20,633 from last week. And we have an average rate of 5% positivity for the past week as well. We have had a total of 734 hospitalizations due to COVID-19. That's an increase of 87 from the past week or 18 from yesterday. However, our active hospitalizations are only at 97. We had 109 last week. So that is a decrease over the past week in our active hospitalizations due to COVID-19. Today, we have a total of 106 deaths due to COVID-19. This includes an additional 2 deaths. However, the numbers on the dashboard will look like we only increased 1 additional death. This is because 1 death from yesterday has been removed for further investigation. This individual tested positive for COVID-19 greater than 14 days prior to death, and so our medical examiner is investigating to determine if COVID-19 was indeed the cause of death. Now we'll have an important development from Gary Harder. He's the Executive Director of the Utah Department of Veterans and Military Affairs.
Thank you. I am Gary Harder, Executive Director for the Utah Department of Veterans and Military Affairs. As part of our department's work, we own 4 veterans nursing homes in the state that we contract with a third-party healthcare provider, Avalon Healthcare, to operate and manage. On May 18th, 2020, we were informed that a resident at the William E. Christofferson Salt Lake Veterans Home tested positive for COVID-19. That same day, the Utah Department of Health and the Utah National Guard arrived to test all residents and Avalon Healthcare employees. The results of that testing were an additional 5 residents and 3 staff who tested positive for COVID-19. The number of residents testing positive increased throughout the week. All COVID-19 positive residents were transferred to the VA Medical Center. A second facility-wide round of testing for residents and employees was conducted on Tuesday, May 26th. Last night, we received these results, and there are now a total of 41 residents and 17 Avalon Healthcare employees who have tested positive for COVID-19. Those additional residents who tested positive on the second round of testing remain in their rooms at the facility. Avalon is engaged with us, the Department of Health, and the VA in developing a path forward. At this time, we do not know how COVID-19 entered the facility. The first positive case was a resident who exhibited symptoms of COVID-19. The initial employees who tested positive were asymptomatic. In fact, at the time of testing, including both rounds of testing, 25 residents and 15 employees were asymptomatic. Avalon Healthcare is working hard to understand how COVID got into the facility and how it has spread. To the families, the care and health of your loved one is our top priority. Our department is dedicated. Avalon and its employees are committed, and we are all doing everything we can to protect residents and staff. This is an extremely challenging virus, but we are determined to beat it. Thank you. At this time, Dr. Dunn and I are available to take questions.
Yeah, this is, what are you all doing this is Ben Winslow with Fox 13. What are you all doing in terms of ensuring that you've got it this time, that you've got it isolated, and that this is not going to spread beyond this facility? I'm assuming you've quarantined all of these people for now?
Thank you, Ben. That's correct. In fact, we've not had any visitors in the facility since mid-March. They've followed all the CDC, the CMS, the Department of Health guidance overall. I think some of it speaks to the insidious nature of asymptomatic spread throughout any facility. We're certainly testing all the rest of our facilities as part of Utah's plan to test all long-term care facilities as well. We're working hard. We can coordinate continually with the Department of Health. In fact, some of the Department of Health members will be up at the facility today to review processes and to make recommendations as well. Thank you.
Hi, Dr. Dunn, Ross Terrell with KUER News. As we've seen recently, the Latinx community now accounts for more cases than any other ethnic group. What's being done to help help slow the spread of COVID-19 among them, and what are some precautions they can take themselves?
Yeah, we're definitely doing even a deeper dive into that. I mean, we recognize this week that the actual number of cases in our Hispanic Latino community is the greatest of all of our races and ethnicities. Things that have been done and we are doing are hiring community health workers from the communities where they live to help out with case investigations and education. We're also working to increase our Spanish-speaking staff for both case investigation, contact tracing, and active monitoring. And we're working with the communities there to understand why spread is happening. A lot of these communities are burdened by, jobs that don't particularly lend themselves to be able to telework appropriately, or they aren't able to be able to socially distance, and so they're in communities that are ripe for COVID-19 spread. So we're working with the community leaders there to do more targeted interventions in those areas.
Got it. And then a quick follow-up. You mentioned 215 new cases, and you gave us the average rate for the week, but that's the highest number of new cases in a single day we've seen in a while. Is that concerning to you at all?
Yeah, I mean, when we look at our cases, it's really important to also not only look at the raw numbers, but also look at the growth rate. So our growth rate has actually remained pretty steady, and a 1.8% growth rate over the past week is actually a good sign. It's a sign that we are plateauing, and we are working hard to start seeing that decrease. So I think at this point, we're really more focused on that growth rate.
Thank you. Hey, this is a question for Gary Harder. So none of the veterans had to be moved out of the nursing home into the VA hospital for care. How are those individuals being cared for in the facility? And what is the status of those residents, of the employees of the nursing home who also needed to have care? Thank you.
Thanks, Jed. On the first piece of it, all of our, there's currently 22 of our residents who are at the VA Medical Center. That was done primarily to remove them from the facility itself. And that's been happening since last Monday, the 18th, up until last evening. Going forward, we're intending on being able to treat those employees and to treat those residents and care for them in our facility itself, essentially turning it into a COVID facility overall. As far as the employees are concerned, certainly Avalon can provide more information on that, but it's our understanding that the vast majority of them are still asymptomatic. Thank you.
Yes, my question is for Dr. Dunn. Ryan McDonald from Deseret News Sports. The National Women's Soccer League yesterday announced the big tournament that's going to be held here. And I was just wondering what the Department of Health's guidance and advice was through the process in having that tournament be held here with the hundreds of people who will be coming here for that.
Sure. So when we advise on large events, we refer back to the Utah Leads 3.0 plan and the detailed guidance we give for all the different colors. So events like this, we strongly encourage social distancing where possible and mask wearing where it's not, in addition to routinely cleaning surfaces. And I'm sure the players in the National Women's Soccer League will be screening their players and staff for symptoms and not allowing them to play if they are in fact symptomatic. So we're following the guidance that we have for all of our events right now.
Thank you.
Dr. Dunn, this is Michael Ortner with the Capitol Press Service and Capitol Press Corps and News Service. We had a question come up about transmission rate. Is there any evidence? Don't seem to see anything on the dashboard that would suggest that you have any way of telling us about that. How do you calculate it, and what is it at this point?
Sure. So we've been following a transmission rate proxy. We use the data we have in order to inform how many people are likely to get infected from one infected individual. And we're using hospitalization as that proxy measure. It is a measure that's used by other states and jurisdictions as well. So ours for statewide has been around 1.1, 1.2 for the past couple of weeks. It does fluctuate day to day. The goal, of course, is to get the transmission rate to be less than 1, because that means that we have control over this pandemic. So for every one infected individual, less than one individual is being infected from them.
Very well. My second question is going to spill from you to Governor Herbert. He issued an executive order recently that's going to stay in place until June 5th. We may infer, I think, that this allows the health department to get a little bit more data before crowd type of restrictions are going to be open. There are some that are being planned for this Saturday evening, and a rodeo in Ogden, et cetera. Brian may want to get in on that with a question, but is that what was going on in that executive order, Governor and or Dr. Dunn?
Sure. So I can't speak to the specifics about the order, but perhaps later we can. However, I do know that, the more days that we're able to get more data on the impact of going to orange and yellow is going to be really important for us to understand when we can, in fact, loosen restrictions to go to green as well. So it is a good idea.
Before that question, let me just add to that again, I just want to remind everybody, as we start to loosen up restrictions, this is a slow, methodical process. And so the emergency order helps us, in fact, allow that to be more methodical, base our decisions on gathering of information and data. So we do this right. We don't want to open the economy too fast. We don't want to open up too slow. We're trying to find that just right balance point. And so hence, I think we're doing a pretty good job of that, actually.
Governor, does that allow you to put some teeth into the enforcement of these crowd control restrictions?
Enforcement is a tough issue because we create policy. The legislature, we have the ability by executive orders to create policy as we, in fact, implement things. And the health department really has priority, the state health department, over the health issues that's transferred to the local health department. So sometimes when we have these issues where they seem to be in conflict, it's the local health department that has to decipher whether the people trying to get a permit for an event, for example, are following the guidelines that have been put in place, and whether they, in fact, can be sanctioned and given a permit. They work closely with the local elected officials to make that happen. We've seen some of the challenge of that with different issues. Here you say rodeo and concert that yet to be determined yet. But I also look at the lagoon opening up, and they follow the protocol very well. They worked with the health department and got the ability, in fact, to open up lagoon for 6,000 participants. That's the way the system's supposed to work. Enforcement has to be at that local level.
Okay, and for Dr. Dunn, this is Chris Reed of the St. George News, and thanks for taking my question. This concerns the number of recovered we talk about. I know it's in the 5,000 range or so, but just a little more understanding of what recovered means. I know we talk about being those who basically have had the virus for at least 3 weeks. Is every person who is recovered, are they somebody who is, so to speak, perfectly fine? They're off to go biking at this point, go exercise? Or are we talking about people who are, I've talked to doctors who say I discharged somebody and they were just good enough to go home. They're not necessarily up and about at this point. Can you just define that a little more for us?
Yeah, so when we're talking about recovered on our dashboard, we're giving a global estimate of recovered cases in Utah. And we use a very simple method. If they've had, they were diagnosed with COVID-19 greater than 3 weeks ago and haven't passed away, it's safe to assume that they have recovered, given the average hospitalization for COVID-19 patients is around 10 or 11 days. So we're taking a conservative estimate there in terms of allowing for 3 weeks to pass. What's really important for us to understand, though, is the active cases. So each one of those active cases represents, the ability for more COVID-19 to spread. And so it's a good sign that our active cases are decreasing.
Let me just, without putting too fine a point on it, just say that one of the concerns we have, we ought to all share together, is really the vulnerable population. I know we talk about this a lot, but it is very true that those who are over 65, those who have underlying conditions, health conditions, are more susceptible to this COVID-19 and the severity of it. We find that 70% of those who die of COVID-19 are over 65 years of age. 90% of those that die are over 65 years of age and or have an underlying condition. So even though we've loosened up to moderate and a low level of risk, for those vulnerable populations, it's still high risk. And so we need to keep that in mind as we start to open up the economy, to make sure that those people take extra precautions, and we that help them and love them and care for them help make sure that they take extra precautions. With that, we've got a couple of minutes for some more questions, and I'll take those. Paul, are you there?
Yeah, sorry, I was muted for some reason. I think I did it myself. But this was going to be for Gary Harder, or the governor can answer it too. As far as looking into the other facilities that the VA contracted with Avalon with, what kind of, have we seen similar kind of outbreaks in those facilities, or was it just confined to the one, or how are we looking into that?
Thanks, Paul. The only nursing home that we work with Avalon on that has positive COVID-19 is the Salt Lake home. None of the other three at Ogden, Payson, nor at Ivins. Again, they're being tested as part of the statewide effort to test all long-term care facilities.
That was my question. Thank you.
Other questions for the governor?
Hi, this was actually for Gary Harder too. I'm a little
the other Gary.
I'm a little confused about the figures that you provided for the home. Is it 41 residents and 17 employees in total over the duration of the outbreak, or is that just the recent test from Tuesday?
Thanks, Aaron. And the clarification is that is total. Since our first positive on the 18th of May up until today, the numbers are 41 and 17.
Okay, and then my other questions were, how many residents and staff are there total at that facility, and have any of these people become critically ill?
The answer to the second question is no. The answer to the first question, there's 81 possible resident beds at the facility. The current census, there were 72 who were in the facility when we, on the 18th of May.
Okay.
Thank you.
The other Gary is back.
Hello, Governor. Thank you for taking my question.
You bet.
Appreciate it.
You're breaking up a little bit.
Question for you related to the Thomas Wright reporting. First, did you attempt to induce in any way Thomas Wright to drop out of the governor's race? And second, if so, do you think you have any exposure related to a possible violation of state law?
Well, the answer to both of them is easy, no and no. Let me just tell you, I'm an unabashed, enthusiastic supporter of Spencer Cox. I think he'd make a fantastic governor. I think we have a lot of good people running. The other three candidates are very capable and good also. Thomas Wright and I go back a long ways. It probably is not known that I've known him for 14 years. In fact, I recruited him to run for office. We've talked about politics many times over the years. He's talked about his desire to run for office and things within the Republican Party as the party chair. We've had multiple conversations on other things besides politics, but we're friends, and he's been a longtime friend of mine. Last year, I went to him and asked him if he would consider supporting Spencer Cox for governor. And he thought about it. But as you know, the first of this year, he decided to run himself for governor. And again, he's a capable guy. That's not really a surprise to me. But he ran, and I know that we all know how the process works, and some fall by the wayside as you go through the process. And he didn't do as well in convention. His poll numbers were down. And so, as happens typically with campaigns, it's time to reevaluate and reassess. So I took that opportunity to talk to my friend Thomas Wright and see what his evaluation was, what was his plans going forward. And I suggested to him, as I'd suggested last year, maybe you ought to consider supporting Spencer Cox for governor. We've seen that this year with the presidential campaign. It's not an untypical thing. As the field gets narrowed and winnowed, and people then start endorsing others that have maybe a better chance of winning. We saw that 4 years ago with Donald Trump as people winnowed by the side and came back and supported the eventual nominee. So we talked about that possibility. He was attentive. At the end of the day, he said, well, I think I know that I'm a long shot, but I want to stay the course and continue on this journey. He said, I think I can win. In fact, he used a golf analogy. I think I can hit 10 birdies in a row. And so he knows he's a long shot, but he thought he could win, and so he decided to stay the course. And so there's no deal been made. It was really about seeing if he wanted to, again, as I posed it to him a year ago or last year, would he be willing to support Spencer Cox for governor? He said no, and he's continuing with his own campaign.
Okay. Thank you.
Hola, Governor. It's Rudy Nieves with Telemundo.
Well, welcome. Bienvenidos.
Thank you. A month ago, the Multicultural Subcommittee was created, which, according to Byron Russell, has identified several problems in the economic, social, health, and even language barriers. However, also according to Byron Russell, resources will be needed to address these pressing situations. The question is, will this subcommittee receive any funds from the Utah Emergency Fund?
The answer is I don't know for sure where the money will come from, what fund. But I know in talking with the legislature and our own agencies, whatever monies are needed to help those folks, we would want to make sure that we get that done. We have some money not only from our rainy day fund that we can access, and we may do that at some extent in the upcoming special session, but we also have some CARE Act money that's being put into the state coffers, which will help us with programs to help those who are less fortunate and need a helping hand. So the funding will come somewhere, and we'll make sure, and again, that hopefully Byron will let us know as they go through this process what their needs are, so we can work with the legislature and make sure that there's appropriate funding available.
Thank you.
Hey, Governor Herbert, this is Michael Locklear with Channel 2. I wanted to see if you could talk a little bit more about K through 12 education and your executive order addressing that. What would you say to parents who might have some concerns about their kids going back to school, and how did you make the decision to go about resuming school activities?
Well, as you've heard us talk about before, the market won't work unless people have confidence that they're going to be safe. Customers won't go back to restaurants, retail outlets, unless they feel safe in the atmosphere. Employees will be reluctant to work. if they don't feel safe in the workplace. And clearly, in our public education system, parents are not going to want to send their children unless they feel like they're going to a safe environment. We've been working very closely with our Utah State School Board. Tammy Pfeiffer, who's my director of education, is working closely to develop protocols so when school opens, say, the first part of September, that they will go, the students, K through 12, will go back to a safe environment. They can feel comfortable and confident. There's going to be protocols in place for hand sanitizers, washing down of desks, some social distancing, maybe the wearing of masks. That's yet to be determined, but they're in the process of working that. We have some proposals that have been given to me. We're in the process of reviewing them to see if there's something we can support, and work with the state school board, the local school boards, the superintendents, and the principals. We'll come up with a program that will give confidence to the people that their children will be safe at school. And we have no choice. We need to make sure that that happens. If not, we're going to lose a generation of our young people that will have a less than stellar education.
And one quick follow-up, are there discussions about how to handle students with special needs or staff and teachers who may have underlying health conditions and may be more at risk for the virus?
Yeah, all types of clientele, all types of students will be addressed. Again, the protocol that I've seen right now is quite lengthy and very much in detail. And so you'll see how that will unfold as we go forward. We already are going to have some probably summer school opportunities for people that maybe fell behind because of lack of ability to attend school. So that will be addressed. I would remind people too to go to coronavirus.utah.gov. You can click down to the Utah Leads Together file, and then click into that, and you'll go to the bottom of that page, and it has guidelines, phased-in guidelines. And if you go to that, you can find a significant detail of how businesses, how recreational facilities, summer games, schools, what they're going to do and what the plans are, what the goals are to, in fact, open them up. So that might be of interest to anybody out there listening. One more question.
Hi, Governor. This is Jacob Kloffenstein with KSL.com. This has come up a little bit in previous questions, but I wanted to ask about the executive order that came from your office yesterday afternoon regarding some of the updated guidelines for the low risk phase. I was just wondering if you could provide any more clarity or detail about what's actually changing with that executive order, and then how it will impact Utahns.
So just you say, how did I determine going into the low risk phase or yellow? Is that the question?
No, this is regarding the executive order from yesterday with some of the updated guidelines for the low risk phase.
Oh, the new edition of the 4.5?
Yes.
Okay, remind me now what the 4.5 was that we talked about. We went through it. Oh, the updated phase. Yeah. Okay. Again, we have a number of people working on our protocols as we, in fact, dial it up and open up. And the protocols they've listed in 4.5, again, you can find if you go to the Utah Leads Together and go down to the guidelines for protocols, and you'll find a lot of the detail. It allows us, in fact, to use data to direct and implement programs that allows the economy to open up with safeguards in place. And it's really a balancing effort, as I said before. It's really trying to find the right balance point and help us to get to where we're fully open. I think many parts of the state are getting to a point where they can start thinking about moving from yellow to green. That may not happen for a couple of weeks, maybe longer, but the data will inform us on whether we can do that or not. I appreciate the good work of the people of Utah, because it really, our ability to open this up and get back to a kind of a new normal is really based on individual compliance and what we're willing to do and do our part to make sure we stay safe and keep those around us safe. So the protocols continue to evolve as we learn more. This is, never been done before. So we're learning as we go. That's why we continue to update our Utah Leads Together plan and the protocols in place there. It really is a dynamic plan. And again, I've said before, and I believe it after talking with all the governors, we have the most comprehensive plan in America here in Utah that get us to safe places and a healthy economy again. So I appreciate the work of so many people putting that together. With that, we thank you. Stay safe and good luck. God bless. Bye.